Mr. John, how are you?
Good, thanks.
Okay, so how do you feel today?
Feel okay.
Any pain?
So,
Okay, can you tell me what date it is?
August 5th, 2020,
Okay, where are you now?
I'm at the clinic.
Okay, who is the president?
Donald J. Trump.
Okay. Well, I took your vital signs already. Your blood pressure is 120/80. Your pulse is 80. Your respiration is 20. Now I would like to check your vision. Okay, I'd like you to look at me. So I'm gonna use the pen light. Okay, so I'm gonna cover with, one. I'm gonna cover like this. Gonna look at me. Look at me. Okay. How many fingers you see?
One,
Okay. I'm gonna move my finger, try to follow it. Okay. Try to point at my finger. Touch my finger. Follow my finger. You have to touch my finger. So, I'm gonna check your head. Okay, you can see your foot is symmetrical. Okay, so I already checked your eyes. So now I'm going to check your ears. Checking this one too. Okay. So now I'm checking your nose. So I'm going to check inside of your nose. Okay. Okay, I'm going to ask you to open your mouth. The tongue, tip up. Going to check the side. Okay, put down. Put your mouth up. Doggy Flakes. Okay. Okay. Okay, I already inspect your skull. I check your hair. Your face is symmetrical. I check your eyebrow, your eyes, your teeth. I'm gonna ask you, can you smile? Okay, can you pull, like clench your teeth? Who pays the door, son? Okay, can you puff your teeth? Okay. So now I'm gonna check some sensation in your teeth. Okay, can you touch? Is it, you're gonna tell me if it is dull or if it is sharp? Okay, dull.
Dull. Dull. Dull.
Okay. This one is sharp. Is it sharp,
Sharp.
or dull?
Sharp. Sharp. Sharp.
Okay. Okay. Okay, I already inspect the eyes. So now I'm going to check sensation in your arm, your fingers as well. You're going to tell me if it is sharp or if it is dull.
Dull. Dull.
Okay, and what this?
Sharp. Sharp.
Okay. So now give me your finger. Can you lift your head up, down? Can you do this? Okay. Can you do this? Can you do, put your hand all the way like you're touching your back? Okay. Can you do the other one as well? Okay. Can you do this? Can you do this? Can you do this?
No, campé, me décampé.
Can you stand up? You want to stand up? All the way there. Can you try to do that, like you're scratching your back all the way? Can you do the other one? Okay, can you put your hand here and try to touch the back and do that all the way there? Okay. All right, you can have a seat. Okay, now I'm going to check your neck, and then I'm going to do the cardiac. Okay, so I'm going to check the back first. Okay. Okay. That's the submandible, and this is the mandible. This is the carotid. Right here, pre-cervical and post-cervical. So now, turn it a little bit this way. All right, so now while I'm here, let me just do this. All right, say 99.
99. 99. 99. 99.
Okay. Say E.
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 Okay. So I'm going to. You're going to take a deep breath for me. Do it again. Actually, can you stand up so we can be seen by the camera? Please turn to the camera. Again. Okay, all right then. Have a seat. Look at you. Okay, all right. I'm going to check your heart. Let me see if I can do it this way. Okay, that's good. I'd like you to lay down so I can check your belly, your abdomen. Okay. Lay down flat. Flat.
Flat, you know.
Be flat. Okay. So I won't be able to inspect the belly since he has clothes on, but if I was able to take his clothes off, or if he was able to take his own clothes off, so then I will inspect the skin. So I will have to skip this one, and I will do palpation. Actually, I will listen to the bowel sounds. Bowel sounds is active. So now I'm going to do palpitation. Palpation. now I'm gonna do deep palpation.
Okay.
And the inguinal will, if I have to palpate it, that will be in this area, and it will be in this area. So I'm going to listen to the aorta. It should be right here. Okay. So now you can have a seat. I'm going to check the leg, the feet, and the toe. Okay, I'm checking the leg, I'm looking at it. Okay, your feet, your toe. All right, good pulse. All right, good pulse. I like to check your brachial and your brachial here. Okay, so now I want to check this to see. Okay. Okay. All right. Let me see. I'm looking for Babinski sign. Okay, one thing I didn't do. You're gonna tell me if you hear any vibration. Okay. Let me do this first.
Yes.
Hmm?
I'm Joey.
When you don't hear anything, let me know.
Feel or hear.
You will hear vibration. Like you will feel the vibration.
Yeah.
You feel it?
Mm-hmm.
So now tell me if you hear anything.
Mm-hmm.
You feel it vibrating?
Yeah. 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 Yes. Yeah.
Okay. So I'm gonna close this ear and I'm gonna say something. Then you will tell me what you hear. 64.
64. 69.
Okay. I'm going to say 3 words. Then I will ask you later on so you can tell me if you remember what I said. Boat, flowers, Kentucky. Boat, flower, Kentucky. Okay. I would like you to stand up. Can you close your legs, like both feet together? Okay. And can you close your eyes? And can you put your arm this way? See over there. Okay. So you're gonna do a knee twitching, like you're gonna take one leg, you're gonna put it here, and do that with your eyes closed. Can you do it the other? Okay. Can you walk like police could be? Okay, can you change the leg? Okay. Alright. Okay, so now can you flex your leg in the back? Can you put it down? Can you do this? And do that? Okay. Can you do that? Extension? I mean abduction, adduction. Okay, can you flex? Okay, and extend. Okay. Okay, have a seat. Okay, I check your feet. There's no edema. You're able to do the joint. You're able to jump with no problem. You did the knee to chin with no problem. You know, the reflexes are correct. You pass the heel to chin. Sensation you pass, vibration you pass it. Actually, let me check your finger. I think I did a cap with you earlier. It was fine. Okay, now I would like you, I would like you to stand again. Okay, so now, can you bend? Go up this way. Yeah, can you bend down? As much as you can. Okay. Can you try to go up? Okay, that's good. Okay, now, Johnny, I'm gonna put my hand here, and you're gonna try to pull back. No, pull your shoulder back up. Okay. see. Do you remember the word that I said?
Boot Flower, Kentucky.
Good. Okay, this is Mr. John Levinsky. He's alert and oriented. He's able to.
Large.
Pardon me?
Large one.
He's able to smile, to hear. He wears glasses. The other test that I was not able to do is because I don't have I cannot check if he's 20/20, but he wears glasses. He's able to read with the glasses as far as his vision. His posture is correct. Able to move his body. His facial expressions are normal. His mood are normal. As far as feelings, do you feel depressed?
No.
Any suicidal ideation?
No.
Okay. His speech is fine. He's alert and oriented for ×3. Skin is normal. Head and face is normal. I was able to inspect his skull, his hair, his face is symmetrical. Can you raise your eyebrow? Okay, able to raise his eyebrow, able to see close. I was able to check his cranial nerve 5 and 7. I checked sensation, which is cranial nerve 5. I was able to palpate his arteries. His temporal arteries. Also is temporomandibular joints in the jaw, his eyes. I was able to inspect his external eyes. Sensation is the arm, hand, and fingers are normal. Capillary refill is fine. It's normal. I was able to check his chest. As I said, also he's able to breathe, able to palpate his chest, feel tactile firmness. I was able to evaluate his chest expansion at T9 and T10. And percuss intercostal space, assess is costovertebral angle, tenderness, oscult is posterior chest. His anterior chest was able to assess that, and his chest expansion is normal, anterior and posterior. I was able to check his neck, no deformity. I was able to check his aorta in his second intercostal space, pulmonic, second left intercostal space, the herb point on the third left, on the third left intercostal space, is tricuspid and the fifth intercostal space, and his mitral valve and the fifth mid-clavicular. I was able to auscultate the apex of the heart. I inspect the abdomen. Everything is symmetrical. The contour looks fine. I auscultate the abdomen. And also for vascular sound in the aorta is renal, iliac, and femoral. I was able to palpate his abdomen, including the spleen, the liver, the kidney. And also I check his leg, his feet, his toes. I observe the muscle, hair distributions, palpate the hip. Actually, I did not palpate the hip. Can you lay down so I can check your hip again for me? I did the knee, the ankle. Okay, so I'm going to do this. Let's see this. Move it this way. Okay. Move it this way. Can you bend like this? Can you bend it again? This way. Are you able to pull both knees up? This. Okay. Can you extend it? Okay. Can you put it up? Okay, and down. Can you pull this one? Okay. All right, that's good. Okay, no edema found, and I was able to test the patella and the achial reflex. He was able to do a heel to chin test, and I tested him for a sensation, and he had good capillary refill. Musculoskeletal observed, the spine curvature checked, no scoliosis found. Was able to do his range of motion. I observed his gait. The only thing I did not observe your gait. Can you just walk with your foot in front of the other one? Yeah. Okay. That's good, thank you. I checked Warburg's side, and also he was able to recall the 3 words that I told him very quickly with good memory. His behavior was appropriate, and that's the end of my head to toe assessment, except one thing I did not check, which I'm going to check now. I'm going to give him something to swallow. Okay. It's only one Goji. Okay. I'm just going to swallow one Goji. Okay. So, he was able to swallow. He's not coughing or anything. So that's the end of my head to toe assessment.